true code blue with a patient that is unconscious, immediately you're going to go to the interosseous. This is what we're putting in if a patient is unconscious. If a patient is conscious, we're going to put an IV in right away. Here's the interosseous kit. You open it up, you have the drill, and you've got the needle and stabilizer kits. You got the cleaner. You want to clean the area off. If you're not sure, remember the drill points. You've got a little cheat sheet. There will be extra normal saline syringes in the kit. You're going to take that and grab the extension set and prime it before you connect it. 2 different size needles. The 25 millimeter, which is the short one, which will go in the tibia.
After prepping the skin, which I've already done in this case, you want to apply the needle to the driver. It's a magnet that holds the needle in place. You want to stabilize the hub while you remove the cap. You want to insert the needle through the skin until you hit bone. And you want to make sure you see the 5 millimeter black mark to ensure that you have enough needle to get through the cortex. Gently advance the needle until you're essentially flush with the skin. You want to make sure you feel that drop or loss of resistance and then advance another 1 or 2 centimeters. In most adults, you're going to apply this so that it's flush with the skin. And you want to make sure you're perpendicular to the plane of the tibia.
Yellow one, which is the longer needle, which is 45 millimeters, it will go in the humerus, in the shoulder.
You can take the palm of your hand and actually palpate the anterior portion of the proximal humerus with the palm of your hand. The patient's hand should be placed over the abdomen in order to help internally rotate the humerus. The other hand should be placed in a perpendicular fashion in the midline of the upper arm, and where my thumbs will come together will define a line over which I should be palpating to feel for the surgical neck. The proper target is about 1 or 2 centimeters or 1 finger breadth above the surgical neck. So I'm using my hands in order to define where along the upper arm I should palpate, and palpating up and down I will feel for the surgical neck. It will feel like a golf ball on a tee. Where the golf ball meets the tee, that's the surgical neck. The proper placement is approximately 1 or 2 centimeters or approximately 1 finger breadth above that. So I've determined my landmarks. I'm eyeballing where I believe I'm going to be putting the needle, and I want to make sure I'm putting the needle at approximately a 45-degree angle, and I'm flush and perpendicular with the plane of the skin at that insertion point.
After needle insertion, make sure you stabilize the lower hub with your index finger and thumb and pull out the driver and stylet. Now place the dressing over the catheter hub. Now attach the primed extension set. Firmly secure the catheter hub with the clamp open. Now draw back to see if you have some blood. If you do, you're in the right spot, and flush it. Disconnect and you're ready for meds. EZIO has a 97% success rate. Everyone needs to come practice with the drill and get familiar with the system. All charge nurses, physicians, and ACLS personnel need to be trained. With this great success rate for an unconscious patient, it's vital to put this access in. It will save someone's life if you can get access in less than a minute or 2 versus trying to get an IV during a full-blown code blue. Remember, the blue is for the tibia and the yellow is for the humerus. Now that you've watched the video, it's time to get some hands-on training. Please connect with us and let's get it scheduled.